For far too long, my constituents have been at the mercy of the health insurance industry, which has dictated how and whether they get their health care coverage. Wisconsinites have been denied coverage because of pre-existing conditions, dropped from coverage because they made too many claims, or simply forced to pay through the nose for skyrocketing premiums. Those days are now coming to an end, thanks to the Patient Protection and Affordable Care Act. We have taken an important step with the enactment of that bill, Madam President. But as you know, our work is not done. The Patient Protection and Affordable Care Act is not perfect, and Congress must be committed to strengthening and adjusting this law as necessary in the years to come. The first step, of course, is for the Senate to pass the Health Care and Education Reconciliation Act of 2010, which the Senate is now debating. This bill will strengthen our health reform law to ensure that health insurance is even more affordable for working families and that seniors actually pay less for prescription drug coverage. Taken together with the Patient Protection and Affordable Care Act, this bill will help Wisconsinites purchase good, affordable health insurance and health care. As a result, this year, children will no longer be denied coverage for pre-existing conditions. Insurance companies will no longer drop Americans because they are sick. Young Americans can remain on their parents' coverage longer. And the Medicare donut hole that shortchanges seniors will begin to be filled. And then, over the next 4 years, states will prepare to set up health insurance exchanges for individuals and small businesses to purchase more affordable health insurance. As a result, an estimated 541,000 Wisconsinites who are uninsured and 320,000 Wisconsinites who have individual market insurance will gain access to affordable coverage. As many as 358,000 Wisconsinites are expected to qualify for premium tax credits to help them purchase health care coverage. And experts believe this reform effort will lower premiums in the non-group market by 14 to 20% for the same benefits. Premium savings, Madam President, of $1,540 to $2,200 for a family in Wisconsin. Now, this is real savings, Mr. President. And according to the nonpartisan experts at CBO, over the next 10 years, our national deficit will decrease by $143 billion and up to $1.2 trillion in the following 10 years. Those savings come from a number of cost containment provisions, including one which I strongly support, that will begin to reimburse physicians based on the quality of care they provide rather than on the quantity of care. This movement toward value-based health care purchasing is one that is already seeing great successes in hospitals and medical groups around my state of Wisconsin. I was so pleased to work with our nationally recognized medical centers around on these successful efforts. Health reform also means more choice, more affordability, and more protections for Wisconsin businesses. Over 77,400 small businesses throughout the state of Wisconsin are eligible now for tax credits starting this year to help purchase health insurance for business owners and their employees. And no longer will small businesses be vulnerable to insurance practices of raising rates on a year-to-year basis due to an employee falling ill. Mr. President, I visit all 72 counties in Wisconsin every year, and I always hear about the burden of health care costs on small businesses. So many Wisconsinites are discouraged from striking out of their own to start a small business or to expand it because they can't afford or couldn't get health insurance on their own. This bill will help those Wisconsinites start businesses and create jobs by providing the affordability and protections of the large insurance group market to small business owners. And, Mr. President, reform also means better and more affordable health care for Wisconsin seniors. The bill we're debating will build upon improvements made by the Patient Protection and Affordable Care Act by closing the Medicare Part D prescription drug donut hole by 2020. Beginning this year already, seniors who reach the donut hole will receive a $250 rebate, with more and more assistance available each year until the donut hole is ultimately closed. Seniors will also be guaranteed an annual wellness visit and no cost sharing on preventive care visits to their physician. Of course, we know this reconciliation bill is not just about health care. It also ends unjustified subsidies from private banks and lenders to issue federal student loans. By transferring the authority to make all federal student loans over to the existing federal direct loan program effective July 1 of this year, we will save approximately $61 billion over 10 years. The savings will in part be used to help ensure that students do not see a reduction in their Pell Grant awards next year, providing much-needed assistance to Wisconsin's low-income and middle-income students when they need it the most. Mr. President, historic health care reform is now the law of the land.